What's up, guys? All right, look, Dr. Chris Park here. I thought it was time for another video about tapering Suboxone. Now, I think my last video, I talked about why you don't want to taper too soon. This video, let's talk about how to taper, my kind of methodology, why I use that, etc. But just remember, all right, so this is just a process that I use with a lot of my patients. I don't use this with every patient, and you need to talk to your doctor about what's the best, process for you. But a lot of you, if you watch my videos, I tend to use an alternating dose approach. As far as I know, there is no research behind this. I have my own, the reason I started using this and why I feel like it works for a lot of people. It works, in my opinion, biologically and physiologically, but also psychologically, okay? And so it kind of hits, the taper process in more than one way, okay? But that being said, there's other ways it can be done, maybe even better ways, and I would be very happy if people would actually, if some scientists would actually research this and come up with a better way for patients to taper off buprenorphine once they were wanting to do it. Now, this is just a caveat, okay? I'm gonna talk about my taper process because most people that I treat are on buprenorphine, either tablets or the Suboxone strips. But Sublocade, which is a subcutaneous injection of buprenorphine, it's basically a monthly, injection. I've had many people, it's not something that I have a lot of experience with, but I've had a lot of people comment on the videos that they have utilized those shots, and then when they were ready to taper, they just stopped getting the shots, and it slowly dissipated, and they didn't have any withdrawal symptoms. So that's something to think about, talk to your doctor about, etc. But I don't have a lot of patients that are willing to get that shot and go through all that. So, okay. So what is my alternating dose method? It's basically like it says. So I do an every other day approach initially. So if you're on 8 milligrams of buprenorphine, I'll have somebody take 8 milligrams one day, 4 the next, then 8 the next, okay? Every other day. So 8 milligrams Monday, Tuesday 4 milligrams, Wednesday 8 milligrams, Thursday 4 milligrams, etc., etc. And we just kind of take that approach for as long as we need to, usually a month or two at a time, and then we step it down, okay? But if that is too much, if that's too big of a drop, because you're basically 8 to 4, it's a big change. You're halving the dose, you're talking about receptor coverage, etc. But if that's too big of a change, sometimes I'll have my patients, maybe I'll have them on 8 milligrams for 2 days in a row, then the 4 milligrams. So Monday, 8 milligrams, Tuesday, 8 milligrams, Wednesday, 4 milligrams, Thursday, 8 milligrams, Friday, 8 milligrams, Saturday, 4 milligrams, etc. And when I do this alternating dose approach, I tell them that I want it on a schedule, though. I don't want them going by how they feel. Now, there can be some problems with this. I don't want them having severe cravings and then, or withdrawal, or maybe something happens, a big stressor in their life. I don't want them trying to taper, during those times, right? That's not the point of the taper. The taper is when you are stable and the risk of relapse is extremely low, right? That's when we taper, okay? So, but if all those pieces are in place, so to speak, we start to taper. Now, I got a lot of cats. I don't know if you've seen this one yet. That's Little Bill. So, all right. Anyway, where was I? Okay, so we might do like a 3-day. So Monday, Tuesday, then Wednesday you drop the dose, then back Thursday, Friday to the regular dose. Saturday you drop the dose. So we might do that all month, maybe 2 months, then go to the every other day. And you can do that at any stage. So let's say you've done fine alternating and dropping, or maybe you've dropped linearly. So you went from 8 milligrams a day to 6 milligrams a day after a month to 4 milligrams after a month. and now you're at 4 milligrams and you try to get to 2 and it's really difficult. Well, then you could maybe try the alternating, or maybe you could try the every 3 days approach, right? And here's the other thing. Sometimes I'll do it once a week. So I'll tell them, take your least stressful day. Let's say it's Saturday. That's your day to take less. Or some people, it's opposite. They want to take less on a day that they're not thinking about it, right? Or something, whatever. So on Saturday, so every day they'll take their 4 milligrams. Saturday is 2 milligram. Then they're back to 4 milligram, right? And when we take this approach, we don't take less on the days, that, again, it's on a schedule. It's not because, I took less yesterday, I felt fine, so I just kept staying less. No, because what happens is, after several days of being lower, they start to feel bad. They just end up going up higher, like back to their old dose, and they say they can't do it. And so I want to stop. That's maybe the third approach. Is I want to stop the mentality that you can't taper. You definitely can. You just have to do it the right way, right? So using the taper method helps a lot of folks, but it may not be the right thing for you. So talk to your doctor. Always talk to your doctor. Do not take advice from the internet. Talk to your doc and see what they think is best for you. All right, guys, hope you have a great day. Good luck. Stay clean, stay sober. Peace.